Good morning. Hi, everyone. It is me, Dr. Ivie Okundaye Appiah. How are you guys doing? Happy Saturday morning. We are live. How is everyone? It's been a while. Today, I hope everyone's doing well. We've been on a roll, seriously. Seriously. I'm going to give a few minutes for people to come on in. Perfect. Happy Saturday and welcome to everyone. Let me know if you can see me and hear me well. I can do a quick check myself. Okay, perfect. Okay, we have a couple of people in here. Okay, so good morning again. My name is Dr. Ivie Okundaye Appiah, and this Saturday morning we are continuing on in our discussion about the Ultimate Health Plan series. It's been really, really good. I've gotten a lot of great feedback and a couple of housekeeping things. Welcome. If you're new here, again, my name is Dr. Ivie Okundaye Appiah. I am an internist as well as a nephrologist. So I am a physician that deals with adults and cares for adults, as well as patients who have kidney disease as well. So that's what a nephrologist is. And honestly, with this platform, what I'm trying to do is encourage, everyone to uplift themselves and be their own health advocates. So we talk all things health and wellness with particular focus for Black people and Black women as well. And again, the way that this channel was started was really as a result of the pandemic, actually. So last year, I remember thinking, like, oh my gosh, there's so much misinformation about COVID. Someone should do something. Someone should do something, right? So I ultimately started this channel to just be a resource for health information, credible health information that really gets at the core of, who we are as human beings, again, with particular focus on, Africans and African Americans in this country. So, I'm here to help. So if you're new, welcome. And that's a little bit more about my channel. Please feel free to like, share, and subscribe. And then if you are not new, welcome back. We have so much planned for this summer. Honestly, it's going to be amazing. So, in the past, what we've talked about has been to encourage Black people and Black women to get into medicine, like to become physicians, because I just feel like we have the heart for it. You know what I mean? In the past, we've talked about, I was recommending that we wear masks before the CDC was recommending wearing masks, and then how to protest and still, protect yourself from COVID. So there's a lot that's happened in the last year, and we have more great content for you, which brings me back to today. So today we are going to be talking about the Ultimate Health Plan series, and really this is for anybody. Anybody. Today it's going to be geared for the bride and the groom. But in the past, what we've done, we've also talked about um, the first topic was the professional woman and the divorcee, and I'll get into that in a little bit. But again, my goal on this platform is to encourage and uplift. Everything here is supposed to be positive. And again, this is not medical advice, this is medical information. I encourage everyone to definitely see their physician, absolutely see your physician, and discuss some of these topics with your physician or with your family members. This is a huge thing. So, welcome back. Okay, and if you haven't already liked this video, so I will go ahead and share my screen so you guys can see. Um, let's see. Yay. Okay, I'm getting, more and more technical with all the stuff, okay? All right, so let me just make sure you can see my screen. I think you can. Perfect, perfect. So, welcome to the Ultimate Health Plan series. Okay, so today we're talking about the new bride or groom. And honestly, this is for anybody who's in a relationship or new relationship or who's cohabitating. Okay, because when you're living in an enclosed environment, you guys get to know each other more on an intimate level. And so a lot of this information is, I think, relevant to anybody, not just, those who are married, but anyone in a new situation. And if you're not, if you've been a bride for a while, or if you've been married for a while, please, I want to welcome you to call in and tell me your experience, okay? So the Ultimate Health Plan series, we've talked about a lot of topics, and this is supposed to help garner, you know, empowerment amongst ourselves. There are unique health issues and challenges that professional women face. We talked about that 2 weeks ago. Last weekend, we talked about the divorcee and making sure that family planning is discussed and STD prevention is discussed. And today we're going to be discussing this as it relates to the new bride or the new groom. Again, this is relevant to really anybody. Okay. So, first things first, you guys know my motto: everyone needs to bring their receipts to the table. Okay, so I'm talking about STD prevention. So the first thing is that I think when you're getting married, I'm a married woman now. And this was something that, I encourage anyone who's coming together to go ahead and do is get a fresh set of tests and just make sure that, hey, you're clean for all of these, common diseases. Chlamydia, gonorrhea are common. I also recommend getting an HIV test in there because it's so serious. And by the way, you don't have to have symptoms. You can literally be asymptomatic or feel completely fine and still have an STD. I just want to put that out there. So get a fresh test and discuss with your fiance or your husband or your partner, whoever, your wife. I've gotten tested. Here are the test results on such and such date, and I'm negative or I'm clean for all these diseases. And then have your partner also do the same. And I also want to recommend, remember, be honest about your sexual history and preferences. Now, that a lot of that is going to be between you and your partner, but what I mean is when you're discussing with your physician, it's important to know, okay, are you also engaging in other like in potentially high risk sexual behavior? That means that we may need to add additional testing on there because not every STD is going to be tested on your routine panel. If there's anal involvement, then that means that there's increased risk of HIV. So I just want to mention that, discuss with your doctor and certainly, with your partner as you feel comfortable what the truth is, because then that influences what STDs are going to be tested, okay? Next point is that remember using condoms. Condoms is good for STD prevention and contraception if desired. And remember that a positive test doesn't necessarily mean it's your most recent partner. It could have been from an old situation. And that's why I recommend that everyone gets tested for STDs with every new partner or every new relationship. So it's easier to pinpoint where did this come from, okay? So STDs, everyone needs to bring their receipts, and it's good just to figure it out before you get married or at the time you're married or even now. It's never too late. Get tested. And if you do find something positive, just discuss with your doctor. Oftentimes it's a quick antibiotic, for example, like chlamydia or gonorrhea. But for those that are more serious, like HIV or herpes, that would be a lifelong thing. But again, remember, these things are becoming more and more treatable. Okay, so don't despair that, there are options, okay? Let me see. All right, perfect. Now, next, The next point I want to talk about is, pregnancy planning and fertility. We've gone over this in detail. If you're familiar with my channel, this is something we've talked about in the past. STD prevention and getting tested, we've talked about that, as well as, discussions about family planning, pregnancy, and contraception. What I will say, it's important for you and your partner to discuss if you desire a family. And I think that most people normally do that. But remember that you can get pregnant at any time period. But remember, the 2-week period after menstruation is when you're most fertile. And so this is when you're most likely to get pregnant. Remember, around day 14 is when an egg is released, but everybody's, physiology and body may be different. Their number of days in a cycle may be different. It could be longer, it could be shorter. Some people may ovulate earlier or later. So this is just a generalization, just to give you some information that in about a 30-day period, the first week is may show menstruation or the actual vaginal bleeding. The 2-week period after the menstrual cycle, that's when you're at most risk for getting pregnant, because that's when the hormones tell us that, hey, this woman is most fertile. I do want to point out that, remember, you have to make sure to take your prenatal vitamin. And caveat, prenatal vitamins are absolutely different than just your general multivitamin. A prenatal vitamin has specific focus on folic acid, and that helps to prevent neural tube defects. Some multivitamins may not have the necessary folic acid content or the dose that you need for folic acid. Remember, prenatal vitamins are important because they have the important folic acid necessary to prevent some brain and spinal cord issues in a developing fetus. So it's important to get that built up in your system before conception, if that's what you desire, But otherwise, a prenatal vitamin will contain your other important vitamins for just overall health. And of course, discuss with your partner about pregnancy planning, contraception, fertility, and all of that. And we've talked about that on our channel. Okay, next point I want to just mention is testing for sickle cell disease. Okay, now, this is going to be geared more so for our African American patients. And, this channel is really for everybody, but in particular, those who are, of African descent and the African diaspora. The reason I say this is that sickle cell trait, these are things that affect our population in our community, right? And so a sickle cell trait is actually quite common. That means those are people who have the trait, not necessarily the disorder. That means that they carry this basically allele or part of a gene that's associated with sickle cell disease. Okay, so about 1 in 12 African Americans actually have the trait. Okay, but if two people with the trait come together and have a baby, that baby is actually at risk of having the full-blown disease. Okay, so remember, if you have a child with another person with sickle cell trait and you have the trait, there's about a 25% chance that the child will have the disorder. And some of you may say, well, who cares? Like, what's the big deal about sickle cell disorder? It's actually a huge deal in our community and actually other communities, because it can cause pain, crisis. It just basically, sickling means that the shape of the red blood cells gets distorted and small, and they actually just break and don't live very long because the blood cells are not well. They're sick. There's a lot of biology behind that, but basically the blood cells, red blood cells, you know, get sick. And so what ends up happening is that your body can develop pain as a result of that. Your blood count can get very low, and it can be really it's a lifelong thing, actually. So it's something that particularly affects African Americans, and I recommend for anybody to just know their status. Do you have trait or do you have the disease? Usually you would know if you have the disease. People who have the trait, though, just a little touch of of the gene, basically, you may feel completely normal. You may be at increased risk for, other things, but normally, they are asymptomatic. But regardless, I say discuss with your physician or genetic counselor if you and your partner both are tested and found to have sickle cell trait. So I just want to at least mention that. And this is a schematic that I pulled from the CDC or Center for Disease Control that shows if mom and dad both have sickle cell trait, meaning the half filled in, then about half of their children will also have the trait, and one of those four children actually have the full blown disease, where the red blood cells sickle and die early on, low blood count, and actually can cause a lot of problems and a lot of pain. And one in four children will actually be completely normal. But you guys may remember this from like Mendelian genetics in sixth grade, depending on your school. I went to a public school. We discussed, kind of stuff like this. But just to reiterate that, sickle cell trait is actually common in our population, and, just plan accordingly and get tested to know your trait. I think it's important for you and your partner to know your status so you can plan and be aware that this is a possibility, okay? Okay. I hope, let me see. Okay, great. So I will move on. Oh, okay. Looks like there's a comment here. Okay, so my daughter has sickle cell C. They just told us she won't have any symptoms. Okay, good, right. Now at 7, she's been diagnosed with precocious puberty. I don't know if one has anything to do with the other. Oh, very good question. I usually not unless there's a rare association between the two. That's a very good question. But to be honest, precocious puberty, meaning sometimes what happens is in children, we develop, sexual characteristics on our body. We develop, breasts, and our body becomes more, adult like and goes through puberty earlier. And there's a lot of reasons as to why that takes place. There are some genetic disorders associated with it, but I'm not aware of any association with sickle cell. Now, I'm glad you brought that up. Sickle cell C is actually, it's a different flavor or variant, actually. But yeah, I'm not aware of any association unless there's a more rare kind of genetic disorder. But certainly discuss with your doctor, okay? Miss Kike, Miss Diva Lomo. I love your name. And thank you for sharing that because, I'm glad. I'm really glad that she actually got tested and is aware and that you guys are aware. So that means like maybe, it's, you never know. Maybe if you guys have additional children, that's just something to keep in mind. That's, it's extremely important. And at least she knows so she, down the road when if she decides to have children, she's aware and can plan appropriately. So kudos to you guys for actually having her tested. I hope that, she's doing well. Usually with those kind of variants, they tend to be asymptomatic or having pretty normal lives. Okay. So thanks for sharing that. Okay. Okay, so I want to just conclude with this part, and this is an extremely important topic, is how to have these discussions with your partner. Okay, I'm going to just break it up like this. So, first things first, it's important to know your own personal history and discuss your personal history with your partner. Additionally, sorry, let me make this larger. Sorry about that, guys. Next, understand your own personal history and understand your own family history and discuss that with your partner. I think just being upfront and aware of issues that come up in your family is really important. And then being able to communicate that with your partner because you're going to be a support system for each other. And I'll give you a couple of examples as to why that's important and how to, communicate that. Of course, I'm not giving you medical advice, just medical information. So ultimately, you need to discuss this with your physician as to how to best support each other medically. Okay. So, for example, I'll just share with you guys, some information about me. Prior to getting married, one thing that unfortunately happens to me commonly is I actually get dehydrated a lot, and I've actually ended up in urgent care a few times for IV fluids, where they give, fluids and hydrate you through the IV. So I needed to get my, blood drawn, make sure that, my labs are looking good and, get hydrated. See, I have tea. So I actually communicated that with my, at the time, boyfriend slash fiance. And I remember there were times when, if he would pick me up, he would hand me a bottle of water. If I ever complain, like, oh, I'm feeling like a little off, he will hand me a bottle of water because he knows my personal history. He knows what's going on with me. And you guys, you know, even if it's simple, you guys know what's going on in your own personal life, but sometimes we even forget things that have happened in the past. So I don't want anyone to necessarily share in detail their own personal history, but just for yourself, think about, hey, what are the medical issues that I see a doctor for on a regular basis? What medical questions, unresolved medical questions or issues have arisen? Do I have unexplained joint aches or pains? Should I figure that out and discuss that? Yes, absolutely. Have I had bouts of depression or anxiety that can really be, crippling? So maybe, it's good for your partner to know so that he or she knows to give you space or give you more, attentions, emotional support, love and affection during, sensitive times. It's extremely important because literally these things, I'm telling you, can save your partner's life. And your life can be saved by your partner. I'm not even joking. Now, remember a few months ago when we discussed the George Floyd case, very also sensitive topic, I recommended that everyone get CPR training. CPR training, meaning knowing how to do chest compressions. If someone was to pass out right in front of you, what do you do? How do you help? We know how to call 911, but CPR literally can save lives. So that's kind of a separate point, but I'm just making the larger point that these things are huge and you can literally save someone else's life just by supporting them and being aware of their issues or health issues. Even if it's small, if it's big, discuss with your partner because you guys are a team. And sometimes, like when I'm communicating with my patients, I'm not just communicating with my patient, I'm communicating with the family or their support system that will make the treatment plan possible. Okay, and I'll give you an example in a little bit. The next thing is discuss your family history. That means you as an individual, you need to know your own family history. And hey, some of us are adopted and it's unknown. That's fine. But if you have information from your father's side or your mother's side, that's important. If everyone in your family has diabetes, you need to know that because chances are it's possible that you're at increased risk for diabetes. Now, I'm not saying that just because a family member has something, you for sure are going to have it. No, but just take note of any trends of things that run in your family. Is there a history of cancer in your family, breast cancer in your family? Then you may need to be screened earlier and you need to discuss with your doctor. Your partner really should also know that. So let me give you a couple of examples. Okay. Diabetes is one. I wrote DM, but diabetes mellitus. This is just a short form, okay? So I used this example before. If let me just say, for example, let's just say, for example, a bride is diabetic, right? I think it's important for the partner to know that and just kind of be aware, like, hey, are you taking medication? Are you not? Are you on insulin? Are you not? Where are those medications? Because there are times when the diabetes can get so bad, you may need help or you may need support, and your partner needs to know how to best support you. If he or she is not aware that you have diabetes, they can't really help you if your blood sugar gets extremely low. Okay, so if your blood sugar gets extremely low because you're taking insulin, insulin helps to regulate your blood sugar. And sometimes, if you're exercising or you didn't eat well, or if you're sick, your blood sugar actually can get quite low. And you might need some orange juice or a snack. Maybe you're too tired, you can't even get up. Have your partner grab it for you, and then we can take it from there. Because I will tell you, working in the emergency room and admitting patients from the emergency room or from clinic, these are things that happen. I see patients because a family member has called 911, or a spouse or some person or a support system has been there and been able to escalate the situation or get help or get care. But to be forewarned is to be forearmed. And so having these important conversations up front kind of helps prepare you in case of emergencies and just for routine everyday life. For example, asthma is something that commonly occurs in general, especially among patients who are, of our community. This is a free tidbit that I encourage couples where somebody has asthma. You need multiple inhalers in the home. Even if your asthma is well controlled, I need to see multiple inhalers in the home. Okay, so there needs to be a designated place, at least 2 inhalers in the home, number one. Number two, 1 in the car. And number 3, at least 1 in the office. So no matter where you go, that you have access to it. And then, make sure your partner also has maybe a rescue inhaler available. Just know, be aware. Because asthma, people can go down quickly. People die of asthma attacks. It's crazy. They really can die from asthma attacks. So having an inhaler, a rescue inhaler, helps to relax and open up the airways and can literally be, really life-saving. So I just threw a couple of topics just so you guys are familiar. The reason I put heart disease and stroke is, remember, heart disease is the leading cause of death in this country, in the United States. And that's true across, all races, especially ours. So another topic, if you know you have heart disease or high blood pressure, for example, what I do and I discuss with my my patients and their support system is like, hey, who's going to be doing the cooking? How many times, who's going to be doing the cooking? And it could be both, which is good. That salt level needs to be low. I don't want to see a lot of salt added on the table. I need to do better with that myself. But anyway, regardless, these are the things that are important, because we can say things in clinic, but if it doesn't translate at home as to actually how to implement the care plan, then what good is that to say, oh, low salt diet, if your partner doesn't even know about it or you don't even know about it? So I just bring all of these topics up as a jumping board to say, have these conversations up front, discuss with your doctor about how to best each support each other, and just be aware, participate, and support. Okay. Next point is the family planning. Is that something that's desired? If you're familiar with my channel, we've talked about STD prevention. We've talked about when pregnancy is most likely. Remember, right after the period, and then contraception. So all of these things should be talked about. Do you want to have a family? When would you like to have a family? What requirements are necessary to have a stable home, income, family support, like grandparents or, potential aunts and uncles to support? Those kinds of conversations should be had up front. Anyway, I'll talk about that later. And then we also talked about depression and anxiety. This is common, especially during this pandemic phase. And it's not something that should be stigmatized. It really shouldn't. But you guys need to know each other. And then, of course, substance abuse, it happens. Is someone a recovering alcoholic? When was their last drink of alcohol? You need to just be aware and know, has that person been to rehab programs in the past? Because you just need to know, have you done that? Because we have to tailor a lot of these health issues, and your partner can play a pivotal role. I hope what I'm saying is resonating with you guys. These are just really, really important topics. Okay. These are just really important topics, you guys. Okay. And what I'll do is I'll end here and just say my ultimate conclusions. Remember, guys, get your yearly physical. All right. So know, what are your health issues? Do you have any new health issues that have popped up? So get your yearly physical, take your prenatal vitamin if you're a young woman. And then also definitely get tested for STDs, get freshly tested, have your partner tested, compare notes, take notes, and have the conversation if anything comes up. The next thing I'll say is know your sickle cell status. This young lady had, mentioned her situation. It's important, if you end up marrying somebody or getting involved with somebody who also has sickle cell, and that person, that child could also end up having sickle cell disorder. We talked about that. Discuss family planning with your partner and knowing your medical history, family history with each other, okay? So that's pretty much what I wanted to say. I will post the link again in the chat. Oh. And see if you guys have any questions. So yeah, please feel free to call in or comment in the chat if you have any questions. Whoops. Let's see. Okay. Okay, great. So, I'll go back to a previous point. So I remember my mother and I. So a couple years ago, I remember I was watching Keeping Up with the Kardashians. I'm just going to be honest, right? I was watching Keeping Up with the Kardashians, and my mom was watching it too, and she's like, "Ivie, come, come, come." And I remember she came and she said, "Look." So at the time, Kim and her husband, I think at the time, it wasn't Kanye, it was, oh, right, Chris Humphries, sorry. They were having a conversation on a rooftop about children, and they were arguing, not really arguing, they were having a conversation about where to have children. The husband wanted the children like Minnesota, and she wanted to stay in LA, and they were already married. So my mom was like coming, she was like waving me over, and she said, "Ivy, watch this." And I'm like, "Wait, what is this? What's going on?" So she said, "Ivy, you need to have that conversation before the marriage, before, about children. Where do you want to raise children?" Do you understand what I mean? So the reason I bring this up is because, it's better. Sometimes I feel like it's better to have these conversations before a marriage or before a new relationship is solidified. But even then, it's never too late to have these upfront conversations, right? Because sometimes we go back and think, hey, if I had known this, maybe I would have done things differently, or I would have been in a different situation. I would have gotten these resources and this help. You know, it happens. It absolutely happens. Okay. So, yeah, it's not easy. It's certainly not easy, but that's what I want for everyone on this platform, is to be able to, support each other and share this information. Okay. So in the last few minutes, just feel free just to call in, or leave any comments or questions in the chat. Feel free to email me. I am also on Instagram at Dr. EVAOA, so DRIVIEOA. And I want to hear from you, okay? A couple things. First of all, does this time frame work? I thought 12 p.m. noon Eastern time would work better for some people, like when you're on your way to the golf course, on the way to brunch, walking around. Let me know if this time works for you. Second thing, what should be the last topic for next week? Ultimate Healthcare Plan series for um, different people. Okay, so let me know. We discussed the divorcee, the bride, the professional woman. I have some other ideas. Um, and just let me know what you think. Any other topic ideas you want to know about, let me know. Remember, this platform is for all of us. Again, my name is Dr. Ivie Okundaye Appiah, MD. Like, share, subscribe, absolutely subscribe, and hit this notification bell. We'll be coming on every week on a Saturday around this time, and share some wisdom. And again, I want to hear from you guys. Okay, so let me know what you think, and we will catch you next week. Hit that notification bell if you haven't already. All right, talk to you soon. All right, bye.